I'm going to talk about non-surgical rhinoplasty today, which is the treatment of the nose with hyaluronic acid fillers. Before I'm going to show you a case that I did the other day, I'm going to talk a little bit about anatomy because there are really significant safety considerations here that every patient needs to know about. This is something that every filler patient should know about, and I like to challenge my patients about this, whether they know it. And this is the most feared kind of complication of a filler treatment, which is called vascular complication or vascular compromise, when the filler accidentally injected into a blood vessel. And why is it so significant regarding the nose? Because as you can see, this is the angular artery, which is part of the continuation of the facial artery. And here you can see the ophthalmic artery, which belongs to the eye. And on the nose and the middle of the forehead, there are connections, straight connections with the outside and the inside circulation of the brain, so with the internal carotid system. So if the filler goes into a blood vessel in the nose or on the nose or in the forehead, there is a higher chance that it can get into the internal carotid system and into the eye, which is a very severe complication, can lead to blindness. So this is a before-after image that I did the other day, and thank you for the patient for the permission that I can use her images. And on the left-hand side, this is the before, and this is the straight after, and pun intended, because as you can see, the nose is straight after the procedure. So she was coming with a so-called dorsal bump, which means that she had a supratip hollowness and a nasofrontal hollowness, and where the arrows are, where I put a little bit of filler with all the safety considerations. And as you can see, straight after the procedure, for the great happiness and satisfaction of the patient, we could straighten the dorsal bump, which is not visible anymore. This is another angle that I can show you the before-after of the procedure, and at the end of this video I'm going to tell you why I was really proud of this patient. So as on the top you can see before the procedure the hollowness under the pencil, and after the procedure you can see how the dorsum, the back of the nose, is straight, so there is no light under the pencil. And the reason why I was really proud of the patient, because she arrived with a list that we ticked out every point on the list together. And the first point of the list was, I'm coming to an expert. The second point of the list was, the doctor is aware of the complications of the procedure, which made me very happy because it meant that she was aware of this. And the third point on the list was that I was going to use a blunt device called a cannula that I didn't use, but I explained why, and I explained her in detail the safety considerations of the nose treatment. So this is why I was proud of the patient, and we did the procedure successfully finally. And if you're interested in filler treatments in general, please check my website. Thank you for watching.